Welcome back to another video. Today we're going to talk about plyometrics. We hear about plyometrics all the time, so I'm going to break it down in today's video, what it is and how we can start safely implementing it into your own ACL rehab today. And so if you're ready, let's get into it. Here's the problem. Only 30% of patients completed a plyometric program prior to returning to sport after ACL reconstruction. A key issue with implementing plyometrics is a lack of guidance, as you can see here, within the literature on how and when to do it. And so the problem is there's 70% of people with ACL after ACL surgery missing out on the plyometric stages. Now we're going to get into exactly what plyometrics are, but this is a huge problem because what happens is plyometrics essentially means you are your ability to produce power, athleticism, and control. And if you can't do that, then you know what happens, right? There's a higher chance of re-injuries. So moving onwards, it goes on to say inappropriate plyometric choice could then cause adverse reactions on unprepared persons after major lower limb injury, which basically essentially means you are at a higher risk for re-injury. And we know the stats are not in the favor, right? We know one in 3 people do not return to their pre-injury activities and levels. We know 1 in 4 re-injure that same ACL and opposite ACL within 2 years. And 1 in 2 do not return to sport due to fear. So these are just to remind you of the horrific stats that are out there for ACL reconstruction. So going back to something that we can control is, can we then include plyometrics safely in our rehab process so that we don't get into these stats over here. Now let's just review, let's zoom out on exactly your ACL rehab phases, right? We've got the early stages, we've got middle, we've got late, and we've got return to sport. So I break it down into 4 different phases. In the early stages, you might remember kind of walking, trying to get your walking back, trying to get your gait patterns normalized. You might remember the pain and swelling that you experienced. You might think about the mobility that you were trying to regain, so trying to get to walk, being able to drive, being able to stand for a long time, just the basic things, right? This is the early phases. If we think about the mid stages, we think about strengthening, stability, and conditioning. The later stages, you're gonna think about power, athleticism, and control. So this is gonna be your plyo stage here, usually injected into the late stage rehab, and sometimes potentially in the middle stages as well. Right? This is super important. When we zoom out, we then understand that we need to start doing plyometrics in these stages, as well as return to sport stages, which is going to be more transition into sport, specifically to whatever you're going to get into. You'll still be doing some plyos there as well, but not as much. Okay, so just wanted to zoom out exactly on where we're going to inject these plyometrics. Now, before getting into the nitty-gritty of what you should be doing, we must understand before you begin plyometrics, are you safe to do so? Now, this is super important. I can't tell you the number of times people just jump into, no pun intended, just jump into plyometrics without any preparation, without exactly knowing if their knee is ready to handle that. So some of the checklists that are out in research, these are the ones that I've collected for you so you can understand easier. You're gonna need a minimum of 70% quad strength. So if you haven't been tested on your strength, you can watch my other video, I'll link it in the description, where you can test in the gym, at least have a general idea, or if you have access to certain isokinetic machines or certain strength machines that they can get tested in the lab setting, then that's even better. But you definitely want to make sure that your quads are going to be able to absorb that load when you jump and when you land. Right? That's going to be one of the more important muscles. Secondly, you need something called good movement quality. So good movement quality can come in various forms, but today we're going to specifically talk about the hip, knee, and foot angle. Right? So we call this dynamic valgus, which basically means we want to see kind of a straight line across all. And then we look at also the torso. We don't want to see leans too much, right? Because that's compensation, as well as the hip levels here are quite level. So from the right hip and the left hip, you want to see good even level, not dipping down on one side. So that's another good thing to have in your checklist before we start any plyometrics. Keeping the pain levels below 2 when you're exercising and after. So if you're still having 7 out of 10 pain when you exercise or the day after you exercise, that's definitely not the time to plug into plyometrics. And this is a common mistake that I see is people just want to advance to the next stages when their knee is not ready to go yet. And lastly, you're not noticing significant swelling in your knee, because swelling is a sign that your knee is trying to tell you that it's not ready to move on. So going back to these points, we want 70% minimum quad strength, good movement quality, specifically the knee, hip, and ankle, as well as the torso and hip rotation. We want less than 2 out of 10 pain and soreness during and after exercises, as well as minimal swelling, or no swelling at all, even better. So we're gonna go into the details of exercise selection, what you're gonna be doing, etc. in future videos. I'm just gonna make this video an introductory video, because plyometrics can be broken down into 3 phases, okay? For something to be a true plyometric exercise, it has to be broken down. It has to have all these 3 components. The first one is going to be called eccentric, and this is going to be the control stage. If you look at the picture below, you are essentially lowering yourself down to try to control the deceleration, okay? That's the first phase. Amortization phase is the transition. So that is this transition between the lowering down and the getting up. So for you to decelerate, stop that deceleration, and then you're gonna push off on the next phase, right? So the next phase is a concentric, which is a takeoff or push off phase. So this is when you do take off, right? People just think about doing this, if they think plyometric, they're just thinking about the concentric phase, just getting up and as high as possible. You've got to master the first 2 phases, which is that control going down and the transition, stopping yourself from, because you don't want to just keep going down and decelerating. You want to go stop yourself, and then you can propel back up. So in future videos, I'm going to break it down into 3 future videos. We're going to zoom in on eccentric, we're going to zoom in on amortization, and then lastly, we're going to zoom in on concentric, and then we're going to put it all together on how you can implement this in your own rehab. And that's it for the video today, guys. So hopefully you found that helpful, and if you did, give it a like, give it a thumbs up, and subscribe, because I will be posting the next series of plyometrics in future videos. And just to let you know, I do have a free masterclass. I'll link it in the description below. It's going to explain exactly the approach that I use to get people back from injury all the way to running, jumping, and playing confidently again. So check it out. I'll see you in the next one.